Within North West London, our approach to integrating care and the model that we've been working on is an ICP model. And because we cover 8 boroughs and 8 CCGs, the way that model was developed was to divide into 2, an inner and an outer. The inner ICP for North West London went first, and it was kind of a year ahead of the outer, and that developed the model and started doing the work on integrating care and brought together a whole range of providers such as ourselves, who are a community provider and a mental health provider, acute trusts, GPs, social workers and other stakeholders.
So we've got quite a large programme, and as part of the large programme there's sort of unique challenges that come with that. The kind of barriers sort of range from there's sort of 3 main things I'd probably say. One is clinical engagement. There's something around how do you manage a large programme with multiple individual sites. And the third is actually the system's always moving, and how do you ensure that you're not adding too much to people's workloads and you can get that transformation and that transition in change. So in terms of the sort of first barrier I talked about with clinical engagement, actually a lot of time needs to be spent when it comes to winning over the hearts and minds of individuals, and I can't underestimate the effort that requires, and it's a lot of face-to-face time and ensuring that people are quite clear and they have created their vision. And that sort of leads into the second point, which is the mix between sort of large scale and the local autonomy, and it could get quite easy to erode some of that local autonomy, so you have to build things in to ensure that they feel that they do have control. And so we've had lots of innovation projects that work across the local boroughs and ensure that they have their identity and we don't erode that. And the third thing around multiple agendas and lots of things going on, actually the system will keep moving. I think what's important for a central team supporting the system should be that we should be there as supportive factors. So we've got the Integration and Transformation Fund coming. Actually we've written a lot of the material for them, and it's about us supporting their transition to that.
I guess the way that we measure success within the North West London ICP is by looking at the patient experience. So obviously we've chosen to work with patients who have complex needs, and we've brought together a number of stakeholders around those patients. And what we're trying to do is to improve the patient experience and the patient outcomes. So that's things such as reducing their time coming in and out of A&E departments, reducing the time that they're having to come in and out of GP surgeries. One of the things that we've done within the outer North West London sector, if we use a patient group which is chronic obstructive pulmonary disease, patients with COPD, is actually we've involved psychologists in the multidisciplinary group, which hasn't normally been done before. And what that's meant is that quite often people with COPD have huge anxiety levels. So as they have problems in terms of breathing and difficulties, they get very anxious, and quite often they end up in hospital because of that. So we've been doing work with a psychologist to help people to manage their anxiety, and as a result of that, that's reduced the number of times they've had to go to A&E. In
terms of the main enablers, I sort of describe them as P's in my mind. So there's something about sort of people, and ensuring you have the right people, and ensuring you spend time around that stakeholder engagement. The other bit is about processes. The processes have to be streamlined and should feel natural to people in the system. And then the final bit, I'll use a P as pay, but not necessarily a monetary sense. It's around thinking about incentives and what's important to people. We're very lucky in that we have become a pioneer, so we're very excited about that. We'd already started to, before we put in our pioneer application, bring together the wider system and actually have the 8 CCGs starting to work together, learning. My top 3 would be probably get the relationships right first time, and then people don't feel coming late to the party afterwards. So make sure you've done that stakeholder mapping exercise or things that you would have done beforehand. The other bit is keep things moving. People want to feel, particularly if you involve them, involvement for a lot of people and listening for a lot of people means that you're changing and you're adapting, and they want to see some of the changes and some of what they've said translated into something that means they're getting services differently. And finally, I think what we're probably very poor at doing is when you start big programs, everyone's waiting for the big monumental change, and actually that's not what's important to drive the system. What you need to do is celebrate the small wins.